Lovely. Well, I think we'll get started as we let the rest in. I'm Nikki Kinloch. I am the CEO of Cure Cancer. It's a pleasure to have you here on another one of our Lunch and Learns. This time we have Dr. Jennifer Currenti with us. Jennifer is a postdoctoral fellow at the Harry Perkins Institute of Medical Research in Perth. They completed their PhD on influenza and HIV in 2022 at the University of Western Australia, which recently awarded them as the Dean's List Honourable Mention. Now they are bringing their expertise in viral immunology and bioinformatics to undertake research on the use of immunotherapy in late-stage liver cancer. So there's a lot there which we will start to unpick. But in the meantime, if you do have any questions, please drop them into the conversation. And there's a little comments box right there at the bottom, and I will weave those into the discussion I am having with Jennifer. And this will also be recorded and shared with you in the coming weeks in case you missed some of it or wanted to share this with fellow supporters or donors. So without further ado, welcome, Jennifer.
Perfect. Thank you so much for having me. Very excited.
Our pleasure. Our pleasure. So first of all, for those that don't know you, and you are one of our new researchers, do you want to give a bit of background about how you came into immunotherapy and liver cancer and all of that? What led you to this career path?
Yeah, so you touched on it a little bit that I did my PhD in influenza and HIV. So in this, I was looking at an immune cell called T cells, and they're one of your main kind of immune cells that will fight off infections and disease, and they also have a really big role in cancer. And so this kind of led me to use these skills and move over to liver cancer, so going away from viral into cancer. And so liver cancer specifically, it has a really poor prognosis. And so I really wanted to try and use my expertise and kind of skills from what I'd learned from viral immunology and really try and help to improve the outlook for liver cancer patients.
So we'll talk more about your research in a moment, but why the shift from your perspective? Is it easy to shift between cancer types or treatment types within your career?
In a way, yes and no. So the no is probably easier to explain because obviously you have a lot of learning to do when you have to kind of get up to date on whatever area you switch to. So for example, I needed to learn a lot more about cancer, but it's not also too challenging because there's a lot of overlap. So a lot of what was learnt and found in viral immunology actually applies in cancer. So while I'm looking at two different aspects from my PhD to now, I'm still kind of looking at the same thing. So I'm still looking at T cells and how they will kill tumor cells, which is very similar to how they would kill, say, virally infected cells. So there's a lot of overlap. So it is a change, but it's still quite similar.
And liver cancer in particular, I mean, it's not one of our more well-known cancers, if that's a fair assumption. I think we're talking around roughly 3,000 people a year being diagnosed with it. So it's still a high number.
Yes.
What in particular drew you to looking at liver cancer in particular?
Mm. Yeah, so you make a good point of it's not one of the highest, I guess, cancers, highest mortality. But one thing with liver cancer is that there isn't really very good treatments.
Mhm.
So, for example, if a patient is diagnosed with liver cancer, there's several treatments they could receive, but the 5-year survival rate is still less than 20%. And so that's quite low. And so we really need to look at new treatment outcomes for liver cancer. And this is where I think I can use my knowledge and really my love of these immune cells called T cells to try and improve these treatment options for liver cancer so that we do increase this really, really low 5-year survival rate. And it's a rate that hasn't really changed, at least in WA. I can't speak for other states, but it's remained very low and, hasn't improved in several years now.
Yeah, I think you're right across the rest of Australia as well. I have to say I do love the fact you've said that you love the T cells. That's great. That's an enthusiasm.
Yeah, it's my nerdy love.
And before we delve into the work that you're doing in particular, I talked about immunotherapy. And for those of us on
Mm.
the call that may not understand what immunotherapy is, could you just explain that a little bit, please?
Sure. So immunotherapy itself is a very broad term. So it covers a lot of different treatments that try, I guess, to boost your immune response so it can kill cancer. But in the case of liver cancer, we use a specific treatment that will try and restore these T cell capacity. So in cancer, your T cells, which are meant to kill the tumor cells, they lose this ability. And so by giving someone immunotherapy, it's meant to restore this capacity so that these T cells can again kill the tumor cells. And, it does work really well in some cancers, but for liver cancer, it doesn't work so well. And so now we're really trying to look at other options.
Absolutely. So the question would be, why doesn't it work well for specifically liver cancer?
And that is a great question. If we knew. No, so that is what we're really looking into, because if we can understand why it doesn't work for everyone, then we can start to find ways where we can change that, or we can give them an alternative treatment. But yeah, look, that is the question really, is why doesn't it work? And so, yeah, we and others are really looking into that.
Lovely. And we also touched on the word biomarkers. Can you explain that? And we'll start to put together your research as well. What are biomarkers?
Yeah, so a biomarker is just really a term for something that can, a measurable indicator of a condition. So, for example, if you, oh, good way of explaining it. Basically, it's just a test that you can use to measure and predict someone's response. And so, yeah, yes, does that kind of make sense for
Yeah,
biomarker? Yeah.
absolutely. So whether there's an impact, so the drugs or the treatments having an impact, and
Yeah.
changing, that makes sense.
Yeah, yeah. So we might look at someone's T cell, and if it looks a specific way, or it acts a certain way, then we might be able to say use that as a biomarker that someone will respond. But then if someone's T cell doesn't have that same kind of characteristic, then that could be a biomarker that they probably won't respond to treatment, and they might need a different option.
So it's almost trying to predict that if certain person has that type of T cell, then they may well respond to immunotherapy. Is that correct?
Exactly, yeah. And for liver cancer, I think it's really important because this immunotherapy at the moment, while it doesn't work so well, it also has a lot of side effects. So one thing we really want to do is try and, I guess, create treatments that will work but not have these side effects. Yeah, really just improve quality of life. And so these biomarkers will really help with that. Well, that's our hope at least.
Yeah, absolutely. And I think the number is only roughly a third of patients benefit from immunotherapy.
Yeah, or
And
less.
or
Yeah.
less, and it's very costly as well, the treatment.
Yes. Yeah.
And also, as you touched on, it has ongoing side effects for the patient
Hmm.
as well.
Yeah.
Yeah.
It's also
So
not hugely accessible, which isn't great because you do have to come in. So, you know, anyone who lives in regional or remote Australia, it's really hard to access this treatment.
yeah, absolutely, and obviously that'd be a big issue in WA in particular as
For
well.
sure, yeah.
Yeah, yeah, lovely. Okay, so we talked about a blood test, or development of a blood test. Could you talk more about what that is and what you're trying to achieve there?
Yeah, so what we're trying to achieve with this is finding this biomarker that I discussed earlier from someone's blood. So I'm looking specifically at what someone's T cells look like in their blood. And then that way, if we can find a characteristic that we're looking for, then we can take blood from patients when they come in and they're diagnosed with liver cancer, and then we can kind of look and assess their T cells. And then we can use this to, if they kind of have this response, this characteristic, then you can give them the immunotherapy. And then, but if they don't, then what I really want to do kind of in the long term is then look at their T cells and say, okay, they don't have this characteristic that we think means they will respond. But then how can we use, you know, what their immune system looks like and how it's working to give them a different treatment that might be personalized, for example, and it might work better. And then your blood test, if we go back to regional and remote areas, it's obviously a lot more accessible
Yeah.
to different areas. So you don't have to be living in a major city.
Absolutely, and we've talked about personalised medicine quite a lot in our lunch and
Mm,
learns with other
yes.
researchers, and that's the beauty of, you know, the impact of the research that you and other teams are doing now. It's giving us this ability to not have one size fits all treatment for
Mm,
someone with breast cancer, for someone with liver cancer, etc. So
yes,
you can adapt it and change it in the hope that it's more effective for that particular person as well.
exactly.
Yeah, incredible.
Yeah.
Okay, so is there a particular patient group do you think could benefit from this the most, or is it too early to tell
Mm.
at the moment?
Um, I think all patient groups would benefit to some extent, but I think it is those patients who are diagnosed at a later stage. So currently, for if you are diagnosed with liver cancer in early stage, there are other options. For example, you might be able to undergo a resection, so they remove the tumor, and then this has a decent outcome, although
Mm.
it does typically recur, which is one thing that we're looking at. So particularly for these late stage patients where we can we can look at their tumor and we can give them a personalized treatment, because currently immunotherapy is their only option
Yeah,
for a treatment. And, you know, as we mentioned before, it doesn't work most of the time and it's quite costly and has a lot of side effects. So if we can create this kind of personalized treatment option, then we believe that it will be more effective, but it will also, you know, have less adverse events.
which would be fabulous, absolutely.
For sure.
Just going to pause there and welcome a couple of new guests. I'm talking to Dr. Jennifer Currenti, who is one of our new researchers and a postdoctoral fellow at the Harry Perkins Institute of Medical Research in Perth, talking about immunotherapy and liver cancer treatment. If you do have a question, I've got quite a few that have come through to me, so hold your horses, Jennifer, we'll get through those. If you do have a question, please drop it into the chat box below. You can direct it directly to myself and I will weave those into the conversation. So can we just talk more practical terms, that if you are a patient and going through treatment, or a late stage patient, how do you go about having this test now? You go into the clinic, what happens and what's the timelines around that?
Yeah, so the standard treatment is you would go into, you know, a clinic, could see your clinician. There's several ways that they could diagnose liver cancer, and then you would pretty much, based on what stage you're at, determines what type of treatment you receive. But then which I think you might be asking, what we kind of envision
Mm.
for our project to then change that is it would be when someone then comes into the clinic with liver cancer, you would get a blood test. We would then look and kind of characterize what your cells look like and how they're acting in your blood. And then that would help. We would give that information back to the clinician that would then help to guide what treatment might work best for you. And obviously, quite a few years down the track, the idea would be that we could create a custom therapy for each person based purely on their blood, their blood test and what cells we're seeing in there.
Absolutely, that makes sense. Thank you. I've got a question around here, and you may not be able to answer because you're not a clinician,
Sure.
but in regards to that liver itself, and obviously a
hmm
liver can regenerate itself, and
hmm
the question being, well, if it can regenerate, can you not just take the tumor out, or why can't you, if that's not the case, do a transplant instead?
Yes. So for the first part, that is removing the tumor itself. So part of the liver with the tumor is what we call a resection, and that is done in early stage. And so what I mean by early stage is that a patient only has one tumor and it's not too big. So if you present at late stage, you would have several tumors and it's just not feasible to remove it because it's too much of the liver basically. And so that is done, but about 80% of these patients who receive a resection, so where we do remove the tumor, they actually recur. And so that means that the tumor does come back. And so it's curative for a little while, but we still need something else. And we think that's because there are still some tumor cells in the rest of the liver that then develop into tumors in the next few years. And in terms of the transplant, I can't speak too much on transplants, but I know it is an option. But as to how it's decided if someone receives a transplant or not, I can't speak on that, but it does happen.
Yeah, that makes sense. Absolutely. So looking at particularly your work that we've funded and the generous donors here,
Mm.
Cure Cancer supporters are funded. How have you progressed since you've started to receive that funding, and what are your next steps?
Yeah, so at the moment, I've really started to. So we have a really good cohort in WA of patients who are receiving immunotherapy. And so I have some blood samples from these patients. Now, this is before they start treatment and also during treatment. And so I've started to really look into these T cells that I mentioned before and starting to characterize them. So looking at how they might behave. So are they able to kill tumor cells? Are they unlikely to? And so that's really where I've started to do that with a small subset of patients at the moment. And then from there, really hoping to try and find a really nice and clear biomarker, which will be great. Whether that happens is obviously another story because research doesn't always go the way you think it's going to, but that's fine. You pivot and you go down another direction and you get somewhere. But yes, ideally I'll be able to find some of these T cells that we look for, and then also to, look at for those patients who we don't think will respond, what can we do so that their T cells, we can make them, better, and so they're able to kill cancer. So it's kind of a two-pronged approach, is predicting response, and then for those who won't, how can we kind of change and help their immune system?
Thank you. A question here around whether it's a specific genetic makeup of an individual. Are you seeing it more in people that identify as male or female? Is it different nationalities or ethnicities? Are you seeing any trends there at all in your research?
In terms of response or in terms of
It doesn't say, but you
just
can give
okay.
whatever answer you would
Okay.
like.
Sure. So there are, I guess, what you could call risk factors. So I think we hear that term a lot when it comes to cancer. So for example, people with cirrhosis, so liver cirrhosis, which can be from hepatitis B and C, that is a risk factor. And you've also got fatty liver disease. So diet and alcohol consumption is also a risk factor. There is a handful of genetic predispositions, but it's not as common. And so there are risk factors to developing liver cancer, but even those people who are at high risk, only a very small portion will actually develop liver cancer. And so there's some really interesting research that's going in to try and see, you know, how can we predict these people who are going to develop liver cancer? Because if you can get it early, you know, that's your best chance of stopping it and really helping with outcome.
Yeah.
And then in terms of response, nothing obvious has come out yet in terms of, you know, predictors by ethnicity or even risk factor or anything like that.
Yeah, makes sense. Thank you. And you've talked about how you have a group of patients that you're working with in WA. Do you do any other collaborations either nationally or internationally on this?
Yeah, so I work with a couple of researchers, one in Adelaide actually, which is where I am at the moment for a conference. And then I work with someone in the UK as well, and he will be really important later on, where he has a company that makes personalised treatments, so what's called cell therapies. So it's using someone's own T cells that I mentioned and kind of picking out the ones that will be most beneficial and then giving them back to the patient to really try and help response. And so that's one possible avenue for where this research will go. And so I'm working with him and using his expertise to really try and make sure that, well, not make sure, but try and get to that end product and end goal that we have.
Lovely, thank you. For those that aren't familiar with researchers or what they do, can you describe, if there is such a thing, about what your typical day looks like?
I love this question. I don't think we have a typical day, to be honest.
Yeah.
It changes. So my day can be, you know, a full day in the lab where I'm processing samples or I'm running an experiment of some kind. But it can also be, I can be sitting at a computer and just doing analysis all day, or I can be writing. I also have some students, so I could be working with the students, meetings, of course, many meetings. So it really changes. And I think that's what I like about it as well, is that you're not always doing the same thing and you're constantly learning and interacting with other people. So you present your results to other researchers, you get feedback, and it's really a collaborative, and yeah, it's different every day.
Yeah. And we talked about at the beginning in the introduction, bioinformaticians as well. Such a fundamentally important role, and it was a stream that we at Cure Cancer used to exclusively fund for some of the years that we funded research. How important are bioinformaticians in the research and what you do?
Very, very, very important. Yes. So now we produce a lot of data, basically. So from each for each patient, I have a lot of information, and to analyze that is kind of where your bioinformatics comes in. So it's essentially just a way of analyzing data. Sometimes it uses machine learning, sometimes it's more coding based. And so these are some things I do as well. So a lot of researchers these days, we kind of do a bit of both because you need to analyze your data. But there are people who are purely bioinformaticians, and we do rely on them a lot as well to help us analyze all this really big data. And for example, if we want to identify a biomarker, there's a lot of bioinformatics that go into that for us to be able to achieve that.
Yeah, lovely. Thank you. So we've talked about how your not so typical day looks. What about your funding? We've heard from many researchers, and you know, the reason why we're here and do what we do is to kickstart careers. Can you talk a bit about the challenges in receiving funding and the importance of getting grants?
Yes. So Funding, I think, is scarce. So there's more people applying for funding than there is funding. And so it's always a challenge. Um, but I think what helps a lot is that, especially places like Cure Cancer and other organizations where it is largely run by, well, not run, but supported by donors. So there's a few at Harry Perkins as well. They run some events where they get a lot of donor input. And this really helps, I think, especially for us early career researchers, where we don't have the track record and we don't have any kind of big amounts of data to apply for these larger grants that are government based. And so things like this, it really allows us to create this data that we can now use and actually become competitive for these bigger grants. And that essentially is really crucial for your career in research, is you need to get these grants because, that's where everything comes from, really. So it's so important.
Yeah, absolutely. And as apart from the funding aspect, what other challenges do you experience in your day-to-day research?
Yeah, so I think some of the challenges would be when things don't quite work out as you would expect, which is also exciting because if you expect your results to go one way and then they don't, then that opens a whole new door to, well, what are we actually seeing? And this is also where collaborators come into use, because whether it's a result that's unexpected or whether it's something in the lab that you're trying to do, but it's just not working, you can really go to these other researchers who are doing similar things to you and get, their input in, okay, we're seeing this really interesting result that we did not expect. What does it mean? And that sometimes is quite exciting and good. And then, your research goes off in another direction that probably was more important than the one you were thinking of.
Yeah,
But that
absolutely.
is definitely one of the challenges. Yeah, it's don't always get what you expect and things don't work a lot of the time.
No, it's absolutely true, and we hear that all the time. And in fact, an unsuccessful outcome is also can be equally positive as well.
Yes. Yes. Yeah.
Um,
And sometimes it pushes you in the direction that's actually more relevant
yeah,
and, gets you a really novel finding that is more useful as well.
yeah, absolutely.
Yeah.
Lovely. I've just had a question come in around
Mhm.
when we're talking about data analysis and bioinformaticians. Do you use AI at all, or any type of modeling in your analysis?
Yeah, not as much. So machine learning, I guess, is an aspect of AI, and I will be using it downstream to try and model some interactions between the cells. So basically, I want to know how these T cells that I'm looking at in the blood might interact with the tumor cells. And so I'll be using machine learning to try and model that interaction. And it is used in a lot of research, but that is the way that I specifically would be using it.
Yeah, lovely. Thank you. A question here around patients and patient advocates as well.
Mhm.
Do you use them in your research?
Yeah.
And if not, is there not a need for them in this type of research?
Oh, there's definitely always a need. Yeah, so I have two, we call them consumers, or people with a lived experience of cancer. And I work quite closely with them. So I would be discussing my project ideas with them. I show them results, and we would discuss outcomes of the work.
Mm,
And they really help to keep you, I guess, on track and making sure that what you're doing is actually needed, and it's going to be useful. And so, yeah, these two consumers, one has a lived experience of cancer, and the other, her husband actually passed away from cancer.
no.
And so she's been really informative on, for example, the side effects of immunotherapy. And, that it's really important that it's not just we want to find a treatment, but we want to find a treatment that still gives someone a quality, some quality of life. And so they are, I would say, argue they're very important in all aspects of research, whether it's at the basic science part or especially definitely more so down towards clinical trials is when
Yeah.
they are essential.
Yeah, absolutely. I agree. And we've met many brilliant patient advocates that have
Yeah.
lived the experiences or are still living with
Mm.
specific cancer types, and the value that they give to the researchers is
Mm.
incredible. Because often,
Yeah.
as some of the audience may be aware, often researchers aren't clinicians, and you really need that kind of third step, don't you, to really understand
Yes.
what the impact is
Yeah.
of your
They
work.
also give you motivation. Like they're so passionate about your project. And I think they really, they support you as well, not just giving you insight. Yeah, they're really supportive of projects and you as a researcher as well. So yeah,
Yeah.
they're very, very good.
Absolutely. A question that we've had come in about what motivates you. I mean, obviously we've talked through the challenges, particularly the funding, and that is a significant challenge. But
Mm.
what keeps you going every day when you get out of bed and carry on your research?
Oh, it's a real philosophical question, isn't it?
So we've got 15 minutes.
Oh, okay. Maybe need longer. Okay. Well, I think it's the constant learning and improving, in science and that you're helping to move things along. And, even if sometimes progress takes a long time and a lot of people, but, you're kind of helping to that in every little bit, whether it's an outcome that, a positive or a negative outcome, you're still helping. Because even if it's something that you don't find, well, not to go down that track and you go a different way. So I think it's really, and cancer as well, like most people know someone who has had cancer. And so it's a really big impact to people. And if we can try and help, prolong people's lives or give them a better outcome, better quality of life, I think that's really, really great.
Absolutely. And the research that you're doing in WA is not just WA based research, it will then go
Mm,
on around the world to
it
have an
will.
impact to others as well, won't it?
Yeah, yeah. And the idea is hopefully what we're looking at, won't just be applicable to liver cancer. If all goes to plan, hopefully we can apply the same techniques and approach to other cancers as well.
Yeah, and I think that's really important to remember. We've discussed that quite frequently in these lunch and learns that
Mm,
particularly with immunotherapy, that
mm,
because it's used for treatment or combination of treatment with chemotherapy in lots of cancer types, those learnings can be translated into other forms of treatment too.
exactly.
Well, um, a question here on funding, and I'll answer it to start with. So thank you for the person that put this in. So they wanted to check that to make sure that any donations they made would go directly to your research rather than to any third party. So from Cure Cancer's perspective, absolutely. So when we receive donations, you can either select to fund generally across all cancer types, and that goes into the pool of researchers we fund each year, or you can specify on your donation what type of cancer type you would like that money to be tied to. And when we get enough of that cancer type to warrant a grant, then we will make sure that we fund that type of cancer research. So from our perspective, all of that money will go directly to the research institute, and in that case, this is Harry Perkins. Jennifer, I don't know if you had any comment about where the funding goes once it goes across to your institute.
Yeah, so just with that as well, while I remember, so I'm at Harry Perkins, but I'm also at Curtin University. So just keep them in there as well. In terms of how I use the money, so for me, it purely goes into lab kind of expenses. So it's the cost of creating all of this data, essentially. So it's what I'm doing is quite expensive. And so it purely goes to cover lab consumables and what we'd call sequencing. So the sequencing gives us this information on the T cells.
Absolutely.
And yeah.
Yeah, and for us, just to reassure people that we make sure we do the due diligence. So in our contracts, for example, when we do fund the different researchers, our agreement is with the Research Institute on that contract, and we make sure that all of that money goes to the researcher. It's actually a clause in our contract. And also the researchers in the application provide us a budget too, so we can understand where that money is going. And the researchers provide us with reports every, well, there's 3 reports they do every 3 to 6 months to make sure that they're on track with both their research and their finances as well. So thank you. Now, where to next? So you'll carry on your research. If we had a crystal ball, you know, we'd know where you exactly, but you know, is the hope then to get to clinical trials with this test? What's your thought? And what's also, I have a question here around what could be the indicative timeline for that as well?
Oh, timelines are always so hard. Timeline, definitely several years. In terms of what next, so in an ideal world, we would be able to find specific markers that we can use quite quickly. And given that it's from a blood test, it wouldn't be too hard to implement because we're not providing, you know, for example, a new treatment. It would just be to help guide treatment decision making and what might be best for that patient. But then the other approach, because if you remember, I said we wanted to try and predict response and then provide an alternate treatment. That one would require a lot more testing, you know, to make sure it's safe, make sure it's effective. And that obviously does take a lot more time. So yeah, it could be several years in terms of creating a new treatment.
Absolutely. And also then once you've done that, there's steps that you have to go through in different types of trials as well, doesn't it?
Yes, of course. Yeah.
Yeah.
Well, you want to make sure it's safe and effective.
Yeah. So you generally, thank you for that question. Generally, if you kind of put a ballpark on it, it is 5 to 8 years we see across all cancer types. There's some cancer types like lung cancer where things are going to clinical trials in 2 or 3 years. And that's because it's one of the biggest killers, sadly, in the world. And they're trying to expedite treatments for lung cancer as well. Well, thank you very much. Thank you to our audience. Jennifer, do you have just any last comments to our donors and fundraisers before we wrap up?
I think really just, you know, thank you so much for your support. It makes this research possible. Yeah, and it wouldn't be possible without donors.
Yeah. No, absolutely. I echo that as well. And thank you to you and your team on the work that you are doing. It is a rarer cancer, but as you've said, it's much needed research, particularly for those that are in late stage liver cancer as well. So keep up the good work. It's a pleasure to have you as one of our cohort for this year. And we will keep everyone up to date with progress reports as and when you make progress, and we'll be able to share those both in our newsletter and online as well. So thank you, Jennifer, for your time today.
Perfect. Thank you so much.
And for the rest of you, please join us at the same time on the 24th of October with kicking off our Lunch and Learn with Dr. Kelly Mushmore, where we were talking about her work on the deadly triple negative breast cancer. In the meantime, stay safe, and we'll see you on the 24th. Thank you.